I start by introducing myself and then verifying that I have the right patient in front of me. After verifying that I have the right patient in front of me, I'm going to start testing their elbow flexion. So I'm going to start with passive range of motion of elbow flexion. With one of my hands, I'm going to be supporting the joint under the olecranon, and the other will be proximal to the wrist joint to control the movement of the forearm. I will take the patient's elbow from completely extended to completely flexed. For active range of motion, I'll have the patient repeat the extended to flex motion of their elbow. Then I do the general growth strength and make sure that the elbow is flexed in neutral rotation. I will then apply pressure at the distal forearm, pushing the elbow into extension. My free hand will be stabilizing the ipsilateral shoulder, and then I go into mid, mod, max, and the patient scored A5. Next, I start their goniometry measurement of their elbow flexion. I make sure that the patient's knees are up, and then I'm going to apply a towel under the distal humerus. I make sure that the patient's forearm is fully supinated, then do passive range of motion into flexion. Then I have the patient do active range of motion into flexion. Next, I take out my goniometer. I palpate for their lateral epicondyle, and that's where the fulcrum of the goniometer is going to go. The stationary will be lateral to the midline of the humerus. Then the movable is lateral to the midline of the radius. The normal range for elbow flexion is 0 to 150 degrees. Functional is 135 degrees and higher. My patient had 142 degrees of elbow flexion. Now using the goniometer, I'm going to measure the length of her triceps. In order to measure the triceps, the patient will be in full flexion of the shoulder, followed by flexion of the elbow. Using the goniometer, the stationary is going to be lateral of the midline of the humerus, the fulcrum is lateral to the epicondyle, and the movable is lateral to the midline of the radius. Normal findings of the triceps is 0 to 150 degrees. Patient's triceps measured 142 degrees. Next, I'm going to do a manual muscle test on her biceps brachii. Her elbow will be flexed to 90 degrees with her forearm fully supinated. Apply pressure at the distal forearm into elbow extension with my free hand stabilizing her ipsilateral elbow, and I do mid, mod, max, and my patient scored A5. Then I'm going to do a manual muscle test on her pronator quadratus. Patient will be lying supine with her shoulder flexed to 90 degrees. Her forearm will be completely pronated. My free hand supports the posterior aspect of her greater distal humerus. Then I apply pressure at the distal forearm into supination. My patient scored A5. Lastly, I perform a special test. My test is called the pronator teres test. This assesses for median nerve entrapment. My patient seated, I will support her elbow into slight flexion. Then the patient is going to resist pronation of her forearm. As I apply the pressure, I look for any pain. There was not, and she scored A5.